In Kenya, the 2014 confidential inquiry into maternal death revealed HDP as the third leading cause of maternal mortality, accounting for 20% of maternal deaths. The prevalence of preeclampsia in Kenya is estimated to range between 5.6 to 6.5%, though proportions are likely higher in rural areas. While HDPs including PE are recognized as a leading cause of maternal and newborn mortality and morbidity, there is an increasing emphasis on early detection and management. Uncertainty around the differences between women who develop PE before and after 34 weeks gestation remains underexplored in low and middle-income settings.
What is preeclampsia?
Preeclampsia is a complication of pregnancy. With preeclampsia, you might have high blood pressure, high levels of protein in urine that indicate kidney damage, proteinuria, or other signs of organ damage. Preeclampsia usually begins after 20 weeks of pregnancy in women whose blood pressure had previously been in the standard range. Left untreated, preeclampsia can lead to serious, even fatal, complications for both the mother and baby. Delivery of the baby is usually recommended. The timing of delivery depends on how severe the preeclampsia is and how many weeks pregnant you are. Before delivery, preeclampsia treatment includes careful monitoring and medications to lower blood pressure and manage complications. Preeclampsia may develop after the delivery of a baby, a condition known as postpartum preeclampsia.
Why is high blood pressure a problem during pregnancy?
High blood pressure during pregnancy poses various risks, including 1. Decreased blood flow to the placenta. If the placenta doesn't get enough blood, your baby might receive less oxygen and fewer nutrients. This can lead to slow growth, intrauterine growth restriction, low birth weight or premature birth. Prematurity can lead to breathing problems, increased risk of infection and other complications for the baby. 2. Placental abruption. Preeclampsia increases your risk of this condition in which the placenta separates from the inner wall of your uterus before delivery. Severe abruption can cause heavy bleeding, which can be life-threatening for you and your baby. 3. Intrauterine growth restriction. Hypertension might result in slowed or decreased growth of your baby. Intrauterine growth restriction, 4. Injury to your other organs. Poorly controlled hypertension can result in injury to your brain, heart, lungs, kidneys, liver, and other major organs. In severe cases, it can be life-threatening. 5. Premature delivery. Sometimes an early delivery is needed to prevent potentially life-threatening complications when you have high blood pressure during pregnancy. 6. Future cardiovascular disease. Having preeclampsia might increase your risk of future heart and blood vessel, cardiovascular disease. Your risk of future cardiovascular disease is higher if you've had preeclampsia more than once or you've had a premature birth due to having high blood pressure during pregnancy.
How will I know if I develop hypertension during pregnancy?
Monitoring your blood pressure is an important part of prenatal care. If you have chronic hypertension, your healthcare provider will consider these categories for blood pressure measurements. Elevated blood pressure. Elevated blood pressure is a systolic pressure ranging from 120 to 129 mm of mercury, mmHg, and a diastolic pressure below 80 mm of mercury. Elevated blood pressure tends to get worse over time unless steps are taken to control blood pressure. Stage 1 hypertension. Stage 1 hypertension is a systolic pressure ranging from 130 to 139 mm of mercury or a diastolic pressure ranging from 80 to 89 mm of mercury. Stage 2 hypertension. More severe hypertension. Stage 2 hypertension is a systolic pressure of 140 mm of mercury or higher or a diastolic pressure of 90 mm of mercury or higher. After 20 weeks of pregnancy, blood pressure that exceeds 140/90 mmHg, documented on 2 or more occasions, at least 4 hours apart, without any other organ damage, is considered to be gestational hypertension.